Well, top of the news, as it is every day, is COVID-19 and how the countries deal with it, especially the hospitals. We see scenes in the hospitals every day, and you wonder, what about our local hospitals? How are they dealing with it and protecting different patients that have different problems? Well, we brought in Dr. Greg Patino, who's a doctor with the Singing River Health System. Good to have you on the show.
Well, thank you for having me. I appreciate it.
Give us a little, if you would, a little background about yourself.
Sure. Born and raised in Mississippi. I grew up in Leakesville, Mississippi in Greene County. Did my undergraduate at Southern Mississippi, then did my medical training at UMMC, and I've been an emergency physician on the coast now for the past 15 years.
Now, people are thinking about emergency services, going to the emergency rooms and hospitals, if they have something that's not, COVID-19 and possibly things like that. How do you deal? How is Singing River Health System dealing with these instances right now?
Right, absolutely. That's a great question. I think that's important to remember, right? Just because COVID is in the community doesn't mean that we're not having the other health problems that we usually have: heart attacks, strokes, and the health system and the emergency physicians are very aware of people's concern about potentially contracting COVID.
Right.
And so we've been taking steps from the very beginning of this outbreak to kind of minimize those possibilities. So right from the moment you get to the hospital, right, you have people asking you screening questions. We also have the capability to take people's temperature when they first arrive by a variety of modes, even some that don't require us to even touch the patient. And then we also have waiting rooms that have been separated, right? The main transmission method for this virus is droplet, which means little balls of spit, little balls of mucus flying out. So
that's why you're doing the social distancing.
That is the absolute reason that we're doing social distancing, right? That can only go so far. So if you're 6 feet away from someone, that's why it's so beneficial, right? You can prevent the spread just by being 6 feet away. So we've actually tried to, make spacing appropriate in our waiting rooms, have separate sections in our waiting rooms. So it starts from the very beginning. Now, once you get back, we actually have created separate units within our emergency departments where we're treating suspected COVID patients that are completely isolated. With the engineering team at our hospital, we were able to put up temporary walls, and so we have units of specialized rooms with what are called HEPA filters and what are called negative pressure rooms, where we treat those patients to minimize exposure outside of that area, both for other patients and for our staff.
Tell me this, we've had so many, we hear about people that die from the flu.
Right.
Every year, thousands of people die from the flu. What's the difference between, the COVID-19, it hit us so hard and so fast.
Right.
It was like, what the heck?
Right.
What's going on? So tell me the difference between these two, between someone getting the flu or COVID-19.
Sure, and that's a comparison that's often used, and I think it's important to differentiate how COVID is different. Probably two things. One, it seems to be easier to spread, okay? So it's easier to give COVID to someone than it is to give the flu to someone. That's what we're seeing, at least for the time being, from the studies we have available. Number two, how sick people get is much higher in COVID. So you and I had talked about this a little bit earlier, where about 0.1% of people that get flu have a bad outcome, okay?
Right.
A death, okay? It looks like for COVID, that's either 0.8 up to 1% of people. So approximately 10 times.
That's a big difference
mortality.
when you're dealing with millions of people in the United States.
That's a huge difference, and you hit the nail on the head, right? It's a numbers game. The more people you infect, the more people are going to get ill, and the more people are going to have a bad outcome from the virus. So the key is limiting the amount of people to get the virus. And the one effective tool that we have for that, the one effective tool is distancing. That's it. And that's why it's critical for the public to continue to keep that in their mind, continue to space out 6 feet.
Right.
If we do that, that's going to be...
Or just stay at home.
Or stay at home.
Stay at home.
Right. Stay at home. That's actually, and I've been hammering that from the beginning. If you have any symptoms at all, you should stay at the house, right? Any symptoms, you should stay at the house. Your family should stay at the house. You should only really go out for necessities. But if you have to go out, right, or even in your own home, you need to practice that social distancing. 6 feet away, right? That's protective for the reasons you and I talked about a little while ago.
Yeah. And I know people are saying, Jim, we see you coughing. Mine started back in January with allergy seasons. And I get this every year. I have everybody around here say the pollen and everything. Yeah, I get this cough. That's it.
Right.
Because there's a lot of other symptoms that go with the disease. I mean, just a cough, okay, but cough, congestion, you're coughing stuff up, headaches, fevers. There's
Right.
so many different things that, if you have those things, you might want to get checked.
Right. Well, that was a perfect introduction, right? The fact that you're having cough, it is cough and it's seasonal allergies, right?
Right.
And we have the flu and everything else. That's why I don't want people to strictly focus on symptoms, okay? Because we don't know. And it really doesn't really matter at this point because our focus has to be on stopping the spread. So even if you don't have any symptoms, which it's important to remember, about 25% of everybody that actually has COVID has no symptoms.
Wow.
Right? So it's important to remember that every single individual needs to be practicing the social distancing because we just don't know.
How are y'all working with local leaders and businesses and everything with this?
Oh no, that's a great question. So the health system, our goal is to try to protect the health of all individuals in our community. And so one of the things our physicians have been doing is we're looking at the results of these tests and we're trying to see if there's areas that have high numbers of positive tests. When we see that, we're reaching out to those local leaders, we're letting them know so that they can tell the community, look, the numbers are spiking here. We need to be very cautious. You need to practice that social distancing because we have to minimize the number of people that are infected.
What about, everybody's trying to get, I see more and more people wearing the masks,
Right.
Gloves. Does it really help?
It helps in certain situations, okay? But, more important than a mask or a glove, again, I'm just going to keep hammering this home, is the social distancing, 6 feet. We use those in high-risk situations where we're having to give treatments that potentially can make the virus spread more easily. So we use those to try to protect ourselves. And in some instances, we're wearing them just to protect you, right? If I have to get close to you, then you don't want me accidentally spitting on you. So, it's a two-way thing. But in the general public, the most important thing to do is the social distancing.
We have a minute left. Saying that, this is about the time this is going to reach its peak and start tapering off. Is it?
My thoughts on that? I don't think so. And again, I think it's very important for the people in the community not to become lax about the recommendations because, quite frankly, this virus is going to be with us for a while. And right now, the CDC and some of the bigger models are suggesting that it's probably going to be beyond 2 weeks before we see the peak. And now it's so important to continue to minimize the spread. So again, just do your part, right? Keep the distance from folks, wash your hands, don't touch your face, and if you don't have to go out, don't go out.
Don't go out. Thank you, Dr. Patino. Thank you so much for instructing us here and giving us some great educational ideas from Singing River Health Systems. And of course, you can find more great information from, go to the website on your screen there and practice that social distancing.